All right, so the video on your right just shows how our laboratory operates. So that's just going to be like background throughout the presentation. But Mother's Milk Bank has been in operation since 1974, and that makes us one of the first, one of the oldest, and also the first nonprofit in the US dedicated to providing screened, donated, and pasteurized human milk to vulnerable infants. Our efforts have resulted in the distribution of 16 million ounces of human donor milk, and that's enough to fill 7 swimming pools. We currently have more than 25,000 milk donors and multiple partners spread across California, Nevada, and Hawaii. And when we mean partners, that could mean either a depot or a collection center or just hospitals that we supply for. Okay, and so I'll just give you guys a background of how we've performed over the last few years, or how California has performed just generally. So California has seen 36,000 preterm births in 2023 alone. And with Mother's Milk Bank, we were able to work with 1,686 approved donors and 140 hospitals to dispense. That is equivalent to 1.2 million ounces of pasteurized donor human milk. That includes around 700,000 ounces of inpatient milk. So these are literally for babies at hospitals, and 551,000 ounces of outpatient milk requests. So for any other moms that aren't producing enough or just regarding their situation, we provide that service as well. However, there's been a 15% year-over-year increase in demand for pasteurized donor human milk. That's just from a recent study we've done. And the demand for pasteurized donor human milk is now going to be nearly 1.5 million ounces in 2025. So that's basically our goal, is to hit 1.5 million ounces this year alone. And we're really going to need your help, because our research shows that only 2% of eligible donors in California are donating milk. And so we are hoping that if we reach more awareness as a united front, we can help hit that 1.5 M. Again, in my previous slide, we only hit about 1.2. So this is kind of a stretch goal, but that's also because the demand has been increasing year over year. And so that is how I am here reaching out now, saying that we need your help. And how can we do that? I'll start off with sharing with you guys the donation process so that you can help orient any of your clients or patients on how to donate milk. It is a fairly simple but stringent process. It starts off with a phone screening, and that takes about 10 minutes. And it's really just about five yes or no questions if they have any illnesses or if they're even able to produce enough milk. Once they are pre-approved for that, we'll then send them out a donor packet. That donor packet, to be honest, has about 50 yes or no questions. And once you fill that all up, we'll need to get that verified by any of your doctors. And that takes about 3 to 7 days. It's really, really dependent on how responsive your doctors are. But really, it's just a sign off that everything they've written down in their donor packet is true. Once that is all said and done, we'll give them a little stub where they can schedule their blood tests through Quest or LabCorp. That's going to be completely free of charge. We just need to do that for any other diseases that we might find. And that takes about 2 days. Once all that's said and done, finally, you could start your donation process. And it takes about 1 day to request for your cooler. So the very moment you call us up and say you're ready to have your cooler, the very next day, a cooler is going to appear right at your front door. And then once you pack at least 100 ounces minimum of milk, that is the milk bank's requirement is 100 ounces, then call FedEx up again and they'll arrive at your doorstep the very next day. And then in 3 days, you've helped a baby in need, quite literally. So yes, so this is about the donation process. Before I move on, do you guys have any questions here? All right. I'm going to move on to requesting for milk. So requesting milk is also, it's actually a simpler process overall. All you have to do is call us up, and then the next day we'll try to give you the milk we have. No prescription is required for non-Medi-Cal clients. And if they have private insurance, they can check with their insurance provider if the provider accepts reimbursements. Shipping fees are dependent on location. I can't give you guys the exact figure for that, but we try to aim to send all our orders by 11 a.m. as overnight delivery. So that's about requesting for milk goes. Any questions? All right. Okay. So
Andrea, could I jump in here? I actually had a question before, but I didn't get my unmute on fast enough. I've had a couple people who have talked to Baby Cafe and said that they wanted to donate their milk, but they said that online it said that if you had less than 100 ounces, that wouldn't be accepted. Is that the situation?
unfortunately, yes.
Okay.
Because everything is covered by Mother's Milk Bank operationally. We hope that you can achieve 100 ounces. You could start the blood work process and everything, and then just let us know that you are aiming or that you see yourself earning or gaining 100 ounces of milk. That's also fine with us.
Okay, I believe the mom I'm thinking of had it frozen already. But so can she donate stuff that she expressed before she did her testing? Or does it have to be something that was pumped or expressed after she did her screening?
No, it can be before. As long as it's within 9 months of expression, that is valid for us.
Okay, thank you.
Okay. All right. So moving to how you guys can help support Mother's Milk Bank, you guys could order rack cards and brochures from us. We have a variety of stuff, and again, we'll ship this out completely free of charge. We have requesting for milk flyers so that you can distribute that to any of your clients and patients, donate milk flyers, and then for any mothers that encountered any child loss and are still lactating and would like to honor their gift to another baby in need, we also have that. Our donor services team is trained to help that mother guide them through that grieving process. And we'll also have multilingual request and donate milk flyers, but right now we readily have Spanish. If you have any other language, we can have that printed out, but right now on hand, we do have Spanish. For our newsletters, we do have medical professionals in our board that can write newsletters for your organization or have your organization featured on our monthly newsletter. So that's gonna be sent out to our donor network. And the most exciting thing that we have is how to start a milk drive. The good news is that anyone can start a milk drive. You start off by informing Mother's Milk Bank on your plans for a milk drive so that Mother's Milk Bank can support that general advocacy. We'll do that by putting you guys on our landing page. We'll even give you guys social media ads. That means we pay Facebook to put you guys across any location, any interest you guys want. We'll even have you guys on Google. And it's up to the person or the organization if they want to write a press release and send that out so that some other coalitions have had themselves featured on TV. So those are also great initiatives. And what Mother's Milk Bank will do is we will track all those referrals coming from that milk drive, just to give you guys that report on how many ounces you've gathered through that milk drive. Into the nitty-gritties of it, the usual delegation of it is inform Mother's Milk Bank on that milk drive, prepare a program, so that can be whether it's as food, educational resources, parking permits, just anything of a program flow you guys want. We're completely flexible with that. The event setup will be on you guys, and we highly, highly encourage pre-screening just because they're going to go through that entire process anyway, and the first step, again, is really only a 5-minute call. That's just about it, but that's just an encouragement from the milk bank. On the Mother's Milk Bank's side, we will be tracking those donor applicants. We will be paying for social media advertising. We will collect that on-hand milk. So we'll give you guys the coolers, or we'll be there to support. And then we can also give you guys any swag bags or raffle items, just so that we can show our support for those mothers that came on site. The shared task is just advertising, a press release. I can work with you guys on that. Social media like design, we can help you on flyers and banners. That's something that we're also completely flexible with. And then I put in this little small fine print that many mothers seek a community in this journey. So that's what makes in-person milk drives really successful. And so that's where I do encourage in-person milk drives. And then of course, another qualifier where we've seen a great pattern is just making sure that you have good parking, timing is good. Hopefully it's not on a rainy day or it's not too cold, and a convenient place to just drop them off. It's hopefully that's somewhere on the Google map interface. So that's about the gist of milk drives in general. Any questions here? All right, last two slides for me. I have some very great news, is that if all of you guys are not aware, but it's official that in May, it is California Human Milk Donation Month. This is the very first year of this, and Mother's Milk Bank spearheaded this with Senator Dave Cortese, and this was announced last May 8th. So every year moving forward, it is California Human Milk Donation Month, and this is our calling to just have this rally cry that every May we can have a united voice and promote that it is California Human Milk Donation Month, and that there is a milk bank and there is a way to help another baby in need. So our goal for this month is to raise awareness about the critical role of donor human milk in infant health, and to celebrate the generous donors and dedicated partners who make this work possible. So please, right now we're still in the process of getting this word out, but hopefully by next year, we can all have that united voice, similar to how we do August as breastfeeding month. Yes. And then on my last slide, we do have a recent report that came out this May, and it's called The State of Human Milk Banking in California. This is a comprehensive report that provides critical insights into milk donation trends and statistics, the growing demand for pasteurized donor human milk, and the evolving landscape of infant nutrition in our state. So we work with a researcher, and we've worked with hospitals to give us any data points that just shares how much we need milk in California right now, how much the Mother's Milk Bank and UC San Diego is dispensing, how many babies are actually in need of it, and of course, the call to action with everyone and how we can achieve those numbers at the end of the report. So if you would like to scan the QR code, I can give you guys that download form, the download document for that. Just scan the QR code. And that's about the end of my presentation. Do you guys have any other questions for me?
I have a question. This is Marisol Ramirez.
Mm-hmm.
So when you were speaking about the milk drive, if an entity wanted to have a milk drive, the persons would bring their milk from home, or they would pump at the location and they would become kind of like a fun event? And how does it work for people to have gotten pre-screened like you would normally if they were going to do milk donation?
Yes, so as long as it's 100 ounces of milk and it's 9 months with an expression, all we need is to have that frozen milk in their bags. And then either if they get pre-screened, we can send them a cooler, so they can physically go and drop that off into that milk drive event. Secondly, they can also use, I've seen multiple moms who've dropped off using their like kids' lunch boxes. And we have a cooler that we'll be bringing, and so we'll stash that in. So either way works, but it has to be frozen only because we have to take into account the travel time as well. And milk can only stay thawed out for a certain number of times.
Right. So the drive is basically just collecting from people who have already gone through the process of going to their doctor, getting their note, and all the pre-screen.
Not exactly. Milk drives are going to be a little bit unique in this sense because we don't want to discourage them from donating at all. If they need space in their freezer, they can drop it off. This is an unspoken rule with us, but if they donate less than 100 ounces, we will accept it. So they don't even have to go through the pre-screening. What we're gonna do though is walk them through that and let them know that they have to go through their blood tests right after, that they can't just drop it off. Like they do have to go through that entire process, but we are never gonna decline any milk we receive.
Okay, I got it. Thank you.
I don't see any questions in the chat. Does anybody else have any questions? And if not, I just want to say thank you so much, Andrea. That was a beautiful, wonderful presentation. It's very organized, and I love how you go through all of what's involved with having a milk drive, which is something that we, you know, we're having an event in August, the Kern County Baby Expo, and we are hoping that the library will allow Mother's Milk Bank to host have a milk drive there. So I know we're going to touch more in detail about this at our next meeting, which is about the Baby Expo on the 21st. So next week, I want to say, don't quote me on that. I will send out an email if you, as a reminder. And if you're not on that planning committee, let me know and I can add you to that email blast. But yeah, thank you so much, Andrea.
Thank you everyone for your support with just breastfeeding in general.
Awesome, thank you. And if you wouldn't mind, could you, I saw earlier there was a way to reclaim the host back, but
I'll give it back to you.
okay, thank you. And Miss Danny, um, let me know.
Hello.
Hello. Let me know when you are ready so I can go ahead and give you the host availability, unless you would like me to share your slides, however.
Oh no, you can make me the host. Thank you.
Absolutely. Yeah. There you go.
Hello. I'm going to share. Can you guys all see my screen?
Yes.
Can you guys hear me okay? Okay, I'm going to move us out the way. Holding the village, the role of community doulas in Black maternal health. My name is Denisha. I go by Danny. I am a community full spectrum holistic doula. Um, I'm also a community health worker. Not only have I been a doula and a medical advocate, but I've dealt with or worked with individuals on a medical standpoint with thalassemia and other inherited blood disorders, such as sickle cell as well, and other um, diseases and disorders. And so my spectrum is broad, and I am now a part of another coalition that I'm happy to be serving. And here in Bakersfield, I am very, very grateful to be amongst an array of amazing doulas. And we have a list that Tariva, shout out to her, has made very beautiful of all the local doulas. So thank you so much for having me. We are going to start off with our first slide. Let me move myself out of the way. Understanding the role of community doulas. Community doulas reflect their communities. Like I said, I'm a Bakersfield native. I moved away to continue my education on the coast. And then I was a doula on the coast for some time. And then I moved back home about 6 years ago. And I tried to do my best to nourish the presence of doulas and increase the doula population here. Recently, very, very recently, I have had the pleasure of being pictured with Mama T. Her name is T. Daniels. She is an OG doula. She was certified back in the day and she practiced. And so the reason why I add this cover is because we talk about at the end of the slide how it is important to go to the doulas before us and the birth workers before us to understand and learn and grow, because you can't know where you're going unless you know where you've been. That's what I believe. Sankofa, there's a term, to go back and get, and it's a term from Ghana. And so that's why I include this picture, but community doulas know and reflect their community. There's a genuine rapport in their community, and you can tell by the interactions. And these community doulas are so important because we are liaisons between our clients and healthcare providers and local resources and things like that. We are in our community. We serve our community in multiple ways. We are the aunties and the big mamas and the sisters and the sister friends. We build kinship. So sometimes with our doula babies, we become aunties and things like that. And it just happens that way because they feel safe with you. And that's something that can't be forced. Um, it can't be made up. It has to be authentic, and clients feel that. And so I noticed that that's a barrier right now because even there's a lot of cultural competency and things like that. There has to be a lot of internal work that has to go on because Black people, we know who are our friends, because we, due to a bunch of environmental factors, have always kind of had to look over our shoulder. So we truly, truly know, through generations of conversation and learning and unlearning, who is truly in our corner. And I cannot express that enough. Like I said, doulas fill gaps. We help with healthcare providers, communication, assistance, access to adequate care, access to resources, um, consulting with clinicians, holding meetings and focus groups and things like that with said healthcare providers, to make sure that we have a good rapport with them. Like I said, or the next slide says that we're uniquely collaborative. We serve everybody. Community doulas don't just serve one class of people, one race of people, we serve everybody. And so as there's like a little disclaimer on the very, very, very last slide at the very, very, very bottom, a lot of our work is so incredibly valuable, but we don't get paid what we are worth. A lot of our cases are pro bono because we are in the community. So our names are shared through family and friends. And so a lot of those people that come from the referrals don't have the income or don't even have the proper health care so that we can bill, even though billing is very recent. So for years and years and years, you've just been doing it because, like I said, that's how you're known in the community. And I myself, even though I have experience and the training, a lot of our community doulas, our big mamas, are not trained there officially or trained through a certification process. They're trained through experience. And I think that there needs to be a lot of respect to that, and that they need to be continuously heard and not try to be put in a box or try to um, be taught to do things a certain way if they've been doing things a certain way and those things have been productive and positive and that they've been smooth and that those processes have been beneficial to the community. I think instead of reinventing the wheel, we need to go back to those people and respect them and really listen to them and give honor to them, because a lot of those people now, they hide or they've had to distance themselves because they've been so asked or so used and so taken from. And once those people have been elevated, they distance themselves or start disrespecting the people that have nourished them. And so you find individuals like myself and others who are so exhausted of that, because at the end of the day, we are Black women and we know Black women go through a lot, and we are expected to be strong and we're expected to take care of everybody, because these stereotypes have been put on us that we are such strongs and we are, you know, consistent supporters, but it's not reciprocated, and it's not reciprocated genuinely. And so that's when you see things in mamas that you don't understand. Like, why do they have higher blood pressure? Why do they have poor nutrition? Why do they have this? Because epigenetics, for generations and generations and generations, they poured into people that have not poured in back. And that takes a toll on the body. It takes a toll on the mental health. It takes a toll on the environment. It takes a toll. And so that's why, as community doulas, we wear many hats. We're not just birth workers and childbirth educators, and but we are also emotional support. And so that's why we have to make sure we're collaborative to talk to mental health professionals, so that way we can have a direct resource or be a direct resource to mental health professionals. Any questions so far?
I don't have a question, but you're doing great, Danny. I just wanted to make a quick comment. One of our attendees, she said she's gonna hop off on a different device. Do you mind just making sure if she does hop on, if you can let her in, please?
Yes,
Thank you,
I'm
thank you.
going to have to, let me see, make sure. Okay, okay, I will keep checking. Thank you so much. Let me go back and let me exit out of this. So identifying common barriers. There is a deep mistrust between healthcare providers and individuals in the Black community. And that stems from a lot of history. James Marion Sims, who was a doctor who did very, very, very heinous experiments on Black women, and to excuse himself from ridicule from his peers and others. He would say that Black women have thicker skin, or we have smaller craniums, or we don't feel pain. And unfortunately, that's because he has been labeled the father of gynecology. That has passed on through generations of healthcare providers. So still to this day, people think that Black women have thicker skin, that we feel less pain, and that we, you know, have smaller craniums, or that our anatomy is different than our counterparts, which is completely false. All of that is extremely false. I like to always share this book with everybody. It's called Jonathan Kozol, Savage Inequalities, Children in American Schools, because Jonathan Kozol, he kind of breaks down why these environmental factors matter so much. He talks about redlining, which is a systemic prejudice where they only allow Black people to live in certain areas of a city or a town. And then that's usually an area where the schools or town doesn't get a lot of money or funding. And so there's not consistent teachers. And so there's substitutes. So the children really don't learn much because there's not a consistent presence. And then they have no activities in the school, no music, no extracurricular activities, no gym, no this, no that. They sometimes don't have working bathrooms. But the schools down the block that have a sense of more Caucasian or other races have these activities, these programs, nice updated books, working bathrooms, etc. And instead of putting these programs into the schools, they hire more police, because these kids end up not having anything, so they end up getting in trouble. And instead of giving them programs and things to keep them busy, they hire more police. So these places lack resources. There's environmental factors. These places usually have factories built on their land. Factories tend to dump chemicals into the soil, etc. So then there's environmental factors. There's health issues that come with that. But then there's no restrictions on these places because nobody cares about the inhabitants that live there. And so I would highly suggest you read Jonathan Kozol. Like, his book, it's amazing. And it just shows how generations lack education, they lack support, and they lack resources because of the areas that they've been forced to live in. And generations are still suffering from that. It still occurs to this day. Food deserts happen in those areas where there's no adequate grocery stores, no fresh produce, there's only liquor stores and gun shops on every corner. We still see that in this day. That's also an environmental factor. Schools not having adequate teachers, like I said. And now we're seeing not enough healthcare providers. And on top of Black individuals not feeling comfortable with healthcare providers as is, as we know in this bottom right corner, I added a picture of the Tuskegee experiment. If you don't know about that, that's when individuals with syphilis who were Black was not properly treated because their healthcare providers wanted to see the effects of syphilis untreated. So they were lied to. They were told that they were treated for bad blood and other things when essentially they weren't treated and they were given placebo effects. And so the syphilis was allowed to have it on their bodies. They still had intercourse with their partners. And so they had children born with syphilis, they infected their partners, et cetera, et cetera. And that, amongst a million other things, is one of the reasons why African Americans, Black individuals, et cetera, people that identify in that way have mistrust because generations taught sterilizations that they didn't know about or consent to that has happened in the Black community. I can go on, but if you ever have the time, I highly suggest everybody read Medical Apartheid, and it touches on some of these issues that I'm talking about. And so amongst just as a doula and as a person myself, have dealt with myself, like some of you know, my son Jeremiah was born in April 10th and he passed away November 27th, 2009, because I was dismissed. When I was trying to explain my symptoms, I was told what I have instead of listened to. And he lived for 7 short months. And I don't remember any eye contact from physicians. I don't remember any real help. I found out what was wrong with me researching myself. I seen counterparts that did not look like me with ports, with home health aides, with et cetera. And I went back to my physician and I was like, why can't I get this? And he prescribed me what he prescribed me, and that was it. That was the end of my care. And I know for a fact, after continued research and continued collaboration and continued conversations with physicians and things, that my son could have been here if it had not been for the color of his skin, if it had not been for the color of my skin. And that I have to live with that every day. And my son is buried very close to my home. I live in Pumpkin Center off the Tap Highway. My son's in Greenlawn off Panama. So I have to drive by my son's grave constantly. So even if I say this all the time, even if I'm having a good day and I'm on my way home, I have to pass that. I have to pass my baby's resting place. And it's a constant reminder. And that's why I struggle to take family pictures with my other children, because I know somebody's always missing. And that's not fair. Like, women shouldn't have to live with that. Nobody should have to be scared to give birth or be scared to get pregnant, or their birth or their experience is so traumatic they don't want to have any more children. They don't want to expand their family. And that is a real fear for many individuals, and not just Black women. But as we know, for a developed country, Black women are dying 3 to 4 more times likely than their counterparts. Here in Kern County, we have the highest infant and maternal mortality rates for our state, and every time I see those stats, I know that I'm in them. I know that my son is in them, and it's a constant wound reopening, because I have to educate individuals so other mamas are not saying the same thing. We do our best, myself and other advocates, to decrease the infant and maternal mortality rates. And so if anybody wants the links to these books, or please let me know and I'd be more than happy to share. Does anybody have any questions or concerns? Okay, I'll continue to move on. The need for representation. I was so happy to be invited to an event. It was a Black Wellness Prosperity Center event in Fresno, California. Shantae is doing amazing work on her team, but I am 36 years old. And it is a shame that this is the first time I've ever seen diagrams that look like this in person as a Black woman. I was so in awe that I could see myself in these diagrams. Sorry. I'm trying to, let me see if I can move this so you guys can see this. That's a birth simulation doll. And she has locks. She has, and the person on this diagram has braids, braided back. She has cornrows. And I've never seen that in my life before. And I just want to stop screen sharing for just a second. And I want to ask anybody, has anybody ever seen Black diagrams?
No.
It's 2025. It's 2025. Why did this have to be such a wow movement in 2025? Thank you for answering honestly. I'm going to go back to sharing my screen. This is what I give all my moms. All my Black moms, I have one for every race as well. But this is what I make sure to provide for my moms. And we have multiple conversations on advocacy and speaking up for themselves, etc. Recognize the importance of culturally relevant trauma-informed care. Hold focus groups with Black doulas, midwives, community health workers, and healthcare providers. Attend local Black focused community events. Get to know your community and build a rapport. Find out who's doing the work and invite them to the table. And the reason why I say that is there's people like me who have been doing the work behind the scenes for many, 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 many years. And other people who take what we say and then they go and they share it. But nobody can share your story authentically. And so when it trickles back down to the individual served, it's not serving them properly, because instead of having the people that do the work being heard, you have people taking their credit or speaking for them. And so it doesn't penetrate effectively. And I'm seeing this over 20 and something years. Find out who's doing the work and invite them authentically and genuinely to the table. Thank them. Give them credit, because those people are tired. They're out there. We could have a lot more progression, but those people that are doing the work, they need to be fed as well. It needs to be a reciprocal relationship. Black people are already tired. We've been through a lot. We're still going through a lot. So a reciprocal relationship is so important. Attend cultural competency webinars, workshops, and symposiums. I'm so sorry. I do want to say, when I talk about Jeremiah, it causes a lot physically and emotionally. And so excuse me if I mess up certain words. Attend cultural competency webinars, workshops, and symposiums. Self-reflection. This is so very important. Sometimes when we look within, we don't like what we see, and that's okay. Sometimes we have to unlearn. Sometimes we have to apologize. Sometimes we have to take accountability. Sometimes it stings. Sometimes it hurts. Sometimes it doesn't feel good. That's okay. Being genuinely open to be teachable, being genuinely open to be accountable, being genuinely open to be educated, and not defensive, but genuinely receptive, being genuinely culturally aware and competent is so important, because, like I said, individuals know who's truly safe. It's an intuition that's embedded. I can't tell you how many times I've had somebody tell me they're safe, but I know they weren't safe. And over time, it unfolded that they weren't. I just had to give it time. And that is a consistent heartbreak that Black individuals deal with. And so being really genuinely safe is so important. being teachable and not defensive is so important. And really going back and reading and getting proper education and being in spaces and eating food and having these conversations and attending these events is a one-on-one learning experience. And going in and not talking, going in and just sitting and listening and looking and learning is so important. I can't stress that enough. Any questions or concerns before I continue? Okay. April 10th, 2025, I'm so happy to say that I was blessed to host my first Black Maternal Health Symposium. And April 10th is very significant because, like I said, it was my son Jeremiah's birthday. And so that was a beautiful, beautiful experience. And we had pre-med and nursing students in the room. And that was my objective, to teach them that Black people feel pain. We are human. Black women are feminine. We are not just like this strong being that society has portrayed us to be. We are fragile and we are weak and we are vulnerable. And yes, we are strong, but we are also everything else. You know, we're allowed to be soft and we're allowed to ask for help and all those wonderful things. And so that they go into the healthcare world knowing that, oh, okay, let me listen to this Black woman. Let me take what she says seriously. Let me run the test. Let me not just deny her. Let me hear her. Oh, she's patting her head because her braids itch and she doesn't want to mess up her hairstyle. Not that she's crazy. You know, Black people, when they get excited, sometimes we're louder. We're not yelling. We're not fighting with each other. We're just a little louder. And one more thing, all Black doulas, we're not, we're not all related. So when you walk in a room and you see a Black doula with a client, that's not our sister. That's not our cousin. We're actually their client. And I deal with that a lot. And so that's why I just want to say, just being culturally competent, this is how we can strengthen the collaboration between WICs and doulas, provide community doulas with resources, handouts, and pamphlets, have a local doula list in the WIC offices, invite doulas in office, provide a space for doulas to meet with potential clients in office, a doula space, provide interested doulas with lactation education, lactation resources, scholarships, etc. Like I said, I have a whole file with WIC stuff. I make sure all my moms, no matter who they are, they get WIC information, no matter their class, whatever, income, whatever. Always tell them apply. WIC has amazing resources for mom's breastfeeding support. I can always call Riva when I need breastfeeding support for a mom, a baby cafe, nesting company. I'm so grateful for it all. Promote breastfeeding and postpartum wellness. I know I'm coming at the end of my time, so I'll speed it up. Promote postpartum rest and educate why it's so important to the mom and birthing mom to rest. We have a snapback culture. No, rest. So much is expected of mom. There's really not a village anymore. Us doulas are trying our best, but we can't be everything to everybody. We need help from the community and from families, so promoting postpartum nutrition, providing recipes and things like that, things that moms can afford or easily accessible or that family members can cook. Promote FMLA education and leaves and supply handouts. I think you guys already do that, but if you can do more, share lactation education resources, programs, and scholarships with doulas, like I said. Educate entire family on the importance of breastfeeding. Moms, grandmas, sometimes they have outdated information that is no longer effective or necessary. And so just in educating the whole family is so important. Have a list of local exercises classes, yoga, Zumba, Pilates, walking groups for moms and dads. Partner and collaborate with your local Blue Zones, and CTEC has a sports medicine program and things like that. Collaborate with them. Reach out to local fitness instructors, collaborate and create partnerships to provide healthy resource classes to clients. You could even have stuff that happens at the WIC office. I teach yoga and Pilates in schools, to doctors' offices, things like that. I'd be happy to come to WIC and teach a little class in the parking lot or in one of the rooms if there's room. And I want to say a lot of doulas are yoga and Pilates instructors amongst other stuff. Like Marisol said, she's a lactation consultants as well. And so there's many of us that wear many hats. Get to know your doulas. Encourage family involvement. A lot of this is repetitive. Educate the whole family about breastfeeding. Sometimes older generations can spread false information, like I said, have pamphlets, educational materials. And on those educational materials, when it comes to Black people, add the dad. Black women, sometimes we are offended. We're married. We have husbands too. A lot of times we're portrayed without the father, or there's nothing catered to the Black dad, or there's nothing catered to the Black grandparents. We're always seeing pamphlets and things with other family members where we're not seeing ours. And so sometimes that mom's like, dang, where's the dad at? Like, my husband's not going to feel included in this. So please provide information catering to the entire family, siblings, etc., on breast milk storage, proper breast pumping, how people can be supportive. If you're not doing it already, please do it. Create educational classes for the whole family. Community can be very beneficial. We have a lot of community resource centers. Let's use them. Hold these classes. Let's do this. A lot of us doulas are so ready. Let's get to going. Make sure these classes are free, low cost, that the information that is shared is accessible and marketable to the potential attendees. A lot of times when I'm out in community and when I post stuff, they're like, I didn't know about that. I didn't know about that. I didn't know about that. And I hear that a lot. Make sure it's, sent to the right people, or give it to people that's doing the work so it can get to the right people so they can attend these events. Identify community-based Black-led doula collectives. So I help train other doulas. I've trained under my belt 70 doulas now, so I'm very, very, very proud of that. I work with each of one of these entities. So these are just some of the women. Last thing that we did was BIPOC. So we had Black and Latin and Indigenous women in the room. And so that was amazing and so fun. And then here is another set of doula trainees. I had to turn the camera on and run to the back, so I'm in the back there. And some of my constituents. This is the Ella Doula Hub. We have a cute chant. We want a doula on every block, and it's so amazing. Dr. Saida calls me a multi-regional doula. I work from Oakland to LA, or I say the Bay to LA. So I take clients all up and down our beautiful state. And I'm over here if you want to play Where's Waldo. But here's some of my beautiful constituents and things like that. And I'm so sorry if I went over time, Jasmine. I'm so sorry. Did I stop sharing?
No, you're good. You're still good on time. We don't end until
Oh,
2:30.
okay. Oh, okay. I just wanted to make sure that I wasn't going over. But yeah, that is my presentation, and I am so grateful for the time, Jasmine. I love our continued collaborations. Thank you for allowing me to share this information. Thank you for allowing me to always hold space to talk about my beautiful son, Jeremiah, and the ways that I love to honor him. If anybody has any questions or concerns, please let me know.
I just wanted to add to what you said about like how people sometimes think that you're like the sister or the cousin, but they're really your client. That is so true. It's happened to me as a Latina doula, to other Latin clients. So we're, multi-brown people in the room, and speaking to a nurse, and I'm helping translate because maybe they're Spanish speaking only. And then I've had my client tell me that after I left, they were asking, is that your cousin? Like, why was she asking so many questions? And I wasn't shocked. I was kind of shocked, but I was kind of shocked at the fact that I was wearing my doula lanyard. I was wearing my medical, hospital outfit that I wear to do doula work. And because I was advocating for my client and asking questions that her herself didn't know how to ask in order for me to help them understand what was going on in their care, I was frowned upon as like, oh, I'm a nosy relative. So I think there's still a lot of work to be done in, especially hospitals that don't see a lot of doulas because they have such a high turnover like EMC. But we definitely need more doulas in in the hospitals supporting our Black and brown people. And, that's the whole thing about having doulas. We do want more doulas supporting more people, because there are lots of people having births and not enough people supporting the families, and protecting their space and helping them have the kind of birth that they might have dreamt of, but maybe would have been possible if they had a doula.
Mhm. I totally agree with you. I totally agree. And I'm so sorry about that experience too. And I feel like um half of our job is just proving that we're there and we're trained and we're not trying to be in the way. We're just trying to be helpful. And that could be a bit exhausting because instead of us catering to our mama, we're proving like I've done the work, I've been doing the work for a long time, you know, I know her, I've been with her for, however long we've been with her. We've bonded, she feels safe with me. I'm not here to, you know, do anything but be a part of the care coordination team and make sure she has not just a healthy baby, but a nice and enjoyable birth experience as much as we can make possible.
And Danny, it looks like Tariva has her hand up, or she wanted to.
It's- I was just waiting. I was waiting. I wish the doulas were around when I was an 18-year-old pregnant mom. Um, a Black pregnant mom at 18. And so just even like at the hospital, I was left in a room alone for hours. They told me my baby's heart rate dropped, told me to turn on my side, and then just left and just left me in the room. My mom wasn't allowed to come in because they had to ask all the have you been abused, all the questions. So nobody was in there with me for like 2 hours. I was just in the room after they just told me my baby's heart rate dropped and lay on my side. And I just feel like they are so important. I didn't even know what a doula was back then. Um, but I think that like, especially for younger moms and first time moms, that they are so important. And the work that you guys do is so important and so amazing. And I think everybody needs a doula um, when they're going in, just because sometimes you are afraid. And I'm a pretty boisterous person, but even for me, like you're at the mercy of other people and you don't know what to ask or what to say. So you guys are doing amazing work, you, Marisol, all of you ladies. So just to say, like, you guys are so important. And I think that that's really, really amazing. That's it.
I do want to say that I'm so sorry, and we've talked, and you're an amazing mother, and the way you advocate and take care of your daughter is just beautiful. Um, we doulas were a prominent, consistent presence in the community. Only rich people or people of not of color could give birth in the hospital at a certain time. And then when it was found out that people could profit off birth, then individuals were forced to give birth in hospitals, and doulas were outlawed. And they were midwives and doulas, the granny midwives and doulas were illegal. And there was stipulations if these midwives continued to practice, there were stipulations put on them. And then once that happened, we've seen an increase in infant and maternal mortality. We've seen an increase in episiotomies. We've seen an increase in all these detrimental issues in the birthing space. And so for the last couple decades, secretly there's been meetings behind the scenes with doulas and midwives, and um, how can we make this better? How can we make this better? But still, there's you know, a a a wall still. But again, nobody can tell your story like you can. And so, because of that, the doulas are being pushed back in the forefront and they're being acceptable again and they're being encouraged to be out in public again because doulas are important and you know, they're essential. And it's being popularized right now because it is a fact. And so I agree with you, Tariva. I think everybody needs a doula. You know, even if you don't want your doula in your birthing space and you just want the education and awareness and you want your doula on standby, and a lot of people don't know that. Some people are private, very, very, very private, you know, and so they don't want sometimes another person looking at their private parts, you know? And so sometimes you can just have that person on standby when needed after having those in-person meetings, you know? And so there's a doula for everybody. There's all kind of different doulas. We all service people in different ways. And so there's a doula for everybody, and there's everybody for a doula. There's so many mommies, you know, and there's so many doulas. But like Marisol said, we are working on increasing the population of doulas because there needs to be there's a lot of mommies and there's not enough doulas here. But yeah. Am I
Hi,
saying
this
this
is
right,
Melissa.
Banya? Uh-huh. Sorry. Hi, Melissa.
Oh, I'm sorry. I didn't mean to cut someone. I'm driving from Fresno. Did I cut someone?
No, you're
Um,
perfect.
okay, I wanted to add everyone. I'm new to the doula work, but I had the opportunity to meet Danny a few months ago. And I just wanted to add that doulas are a covered benefit for Kaiser Permanente Medi-Cal members and commercial members, but also for other managed care plans. So it really helps to make these services accessible for a lot of people. And I'll share a flyer with Jasmine. That way she can maybe send it out with, you know, whatever recap goes out. So you all have that available as well. Just know that there's, through the managed care plans, this is available to everyone, basically.
Thank you so much, Melissa. Yes, please send that my way and I'll share it with everyone else. And I see there's a hand up, Araceli Trevino.
Yeah, so thank you, Denisha, for your wonderful presentation. That was very, very lovely. And I just wanted to comment that I think you guys are doing a great job. And I had the opportunity to refer one of our members that was participating in our program. She was a young member, first time being a mommy, and she had a lot of questions and doubts of like what to expect the day of the labor. And when we referred her to a doula, she then said after like receiving the services that, you know what, I received a lot of education. I'm no longer worried because I know what to expect. And she said that she really loved the services of the doula provider because it really helped her to prepare for the birth. So I really believe in the job that the doula providers are doing. It is part of our process here at Kern Family Healthcare. At any time we reach out to our pregnant members, because it is a cover benefit on our end as well, and we're promoting it. I think there's pamphlets going out to our members, and hopefully we can do something like a commercial to talk about our doula providers. But yeah, here at Kern Family Healthcare, we make sure that we talk about the services that you guys offer, and I just want to mention that you know you guys are doing a great job, and thank you for reaching out to our members and offering them your guys' time. There's a lot of new members that are you know they're young, they're pregnant, they don't have family members, and I know I probably shared this in the past, but like when I talk about all the services that you guys offer, one of the things that mostly stands out is that they're gonna have someone to, you know, like you said earlier, becomes like their auntie, their cousin, even though they're not related to them, but it becomes that's how you know they are to them. So thank you for your hard work and everything that you guys do. We really appreciate it here at Kern Family.
Thank
I
you,
just
Araceli.
want to say, oh, sorry, Marisa, go
I just want to say thank you, Araceli, that you're referring to us, because I know that the Spanish only speaking clients who are coming to me through Kern Family, I just see the relief on their face.
Mm-hmm.
And, you
Oh,
know, change, they change from the first meeting to their next meeting. They're just so different. And when they bring their spouses, they're so included, and their spouses are so much more comfortable that like they have somebody else to help them help their partner. And yes, it's just such beautiful work. And I'm constantly trying to recruit people who speak Spanish, because there are so many Spanish only speakers, and they come from countries that um, you know, they're used to just being a lot of them have white coat syndrome, like whatever the doctor says. And so instead of like being educated on why the doctors are asking them to make these certain decisions, and so having a person like a lay voice to kind of explain what's going on with
Mm-hmm.
their situation just makes them feel so much more relieved. Like, they just look so much more relieved. Their shoulders, I can tell on their face, it's just so beautiful. And it's heartwarming and sad all at the same time.
Oh, you're welcome, Marisol. Yeah, I think that, we work together as a team, the insurance and the doulas and, the member providers get a better outcome from them. They start to be more compliant and it's true. It's sometimes, it may be the language barrier, or maybe sometimes, like you said, they'll do well whatever the doctor says, and then sometimes they leave their doctor's office not knowing anything about gestational diabetes or preeclampsia. So, but they're willing to learn. It's just they need that person to help them, to educate them, and then they start being compliant, and because they didn't know before, but now they do. They know the risk, that is not just for them but for the baby as well. So I think when we work together like that, at the end is the member or the patient who benefits, and also the baby. And it's good to see that we all collaborate together, and I really appreciate this meeting, because I get to know new people, and what kind of services they offer to the community. So thank you so much for that. Again, Denisha, that presentation was very lovely.
Thank you. Um, I want to just say, Current Health Systems, your team has been consistent. You guys have been so kind. Outside of this duels, every time I see something in the community, Current Health Systems has sponsored, or you guys are there. So you guys have been a consistent presence in our community, and I just want to say thank you. I know you guys probably hear that a lot, but personally, I want to say thank you. Um, and yeah, same thing with Cap K and Wick. Thank you guys. Like I said, I put the little programs. I know the other doulas do. So for providing spaces for us doulas to talk and to share, and to thank you for advocating for us and all this just amazing community work that's going on. It really like makes my heart full. So I'm so grateful. Yeah. And these conversations, like you said, are so needed. And so, like Araceli, like you said, you refer the doulas, and Marisol, there's doulas for everybody. There's no language barriers. Like, these moms are really getting what they need. And it's just a beautiful, it just makes me so happy. There's going to be a lot less sad stories in the next couple of generations, you know?
Yeah, one birth at a time.
I love that. And Danny, can we just see your shirt? It's
Oh, I wear shirts yeah. Anytime you
love
see
it.
me out. Oh, hold on, wait. So I wish you guys could see my computer, but you can't. But I have support birth workers, certified birth nerd, birth nerd. This is our Black women birth justice. It's all about that Black dual magic, like on my shirt. Advocating for your voice, your choices, your birth. Of course, Alicia, she left, but I have my Kaiser, and my birth story inspired me to do the work. So I always have. I remember one time I was in Walmart and I had my shirt on that says "Black birth is not a battle; it's a birthright." And a woman actually, she said, "Can I read your shirt?" And I never assume anybody's pregnant, but I was like, "Yeah." So I showed her my shirt, and she read it, and she was like, "Oh yeah, I'm pregnant. I'm scared." And I was like, "Well, I'm a doula." And we started talking, and I helped her bring her baby girl into this world safely. So she had a way better experience than her first birth, and her daughter was 9. I think she's 9 or 10, and so I helped her incorporate in the birth, even though we were in the hospital. And so she got to cut the umbilical cord, and she was the first one to hold her sister. And so she was just so happy. And when her mom was, birth, there's a lot of noises and things. And so I was just like reassuring her that mommy's okay. She's just, welcoming your sister. And we had a lot of conversations. And so now she's like, I'm a doula. I'm like, yes, you are, baby. So it's so cute. I love my postpartum. I'm gonna be really sad when our postpartum visits are done, because it's so cute. She thinks she's a little doula. So yeah.
I love that. Thank you so much for sharing. But were there any other
Yeah.
questions, comments, concerns, or I do see you're getting love in the chat too. Thank you for sharing your son's story, Danny.
Thank you. Thank you so much. And you guys are awesome. And yeah, I'm done. I'm gonna mute myself. Thank you, Jasmine, so much.
Absolutely. You're always welcome. And I just wanted to say again, thank you for shedding light on this vital topic. It's important to have, like how you were mentioning, cultural competency and community-based care. And we're grateful for the opportunity of learning from your experiences and the stories and the history. And I know there's going to be someone on the chat that is wanting to know more. So thank you again for everything that you do. You are truly appreciative here, as you can tell from everybody is showing you love. Um, and yeah, thank you so much, Danny. If there's any events, anything you want to share, everybody, this is now open to everybody that wants to share any events, flyers. The floor is yours.
I know BIMHI is having a provider symposium. It's on Eventbrite. It's Friday. And Jasmine, I don't want to speak for you guys. I don't know if the WIC event is public or it's just for you guys.
No, yeah, yep. Yes. So we do have an event, and anybody on here is welcome. I know it's last minute. But we're having an event with all Clinica Sierra Vista WIC staff at the Heart Park. We will send out a message where exactly we're going to meet, but we will not be providing tables or chairs. But you're welcome to just show up and pass out flyers, or our staff. We're going to start off doing a fitness event, a fitness kind of activity, and then staff are going to go around to different vendor tables and get information. There's going to be Jamba Juice samples, refreshers, and it's going to be a fun event, a fun little day at the Heart Park. So if you are interested in coming out, even if you don't have a table, let me know and I can connect you. Thank you, Danny.
When is that, Jasmine?
Oh, sorry. That is this Friday, the 16th, from 1:30 p.m. all the way to 4.
Okay, thank you.
No problem.
And I'll just add that starting in August, I can't give you the exact date now. I'll give additional information as it comes up, but just know that coming up, the maternal, child, and adolescent health programs here at Public Health, we will be starting a 10-week prenatal education course. It'll be 1 day a week. They'll be held at the Beale Library. Various topics each week. We'll have a Spanish session, and then it'll be repeated in English in the afternoon or vice versa. I'll give you the dates forthcoming. But just keep that in mind. If you have any women that are pregnant, it's free of cost as well. There's no cost.
I just wanted to just throw it out there. We, Three Moons Doula Collective is a new group collecting, taking names for any persons of color and bilingual who like to become doulas here, in-person training in Kern County in Bakersfield. We have a cohort starting already in June, and so we are taking standbys and wait lists for our September course, which is going to be starting, it'll be at the end of the September as well. And you can email me if you're interested at the email that I provided on the chat.
And if you forget or if you don't have the flyer or all the information for any future events, feel free to email me. I won't be sending the recap this week, but my goal is for next week to send that recap. So please, you have some time in case you'd like to share anything.
Jasmine, did you want to talk about the expo?
Oh, yes, thank you. So yeah, the expo is going to be held, the meeting, the next committee meeting is going to be on the 21st, which is next Wednesday. And I believe it's 1:30. Yes, 1:30 to 2:30. So if you would like to be on that planning committee meeting, message me and I will add you to our email list so you can get that invite. Did I miss anything?
Just use that it's
Awesome.
going to be in August, right? We have the date and everything for it, so that everybody knows August 25th.
Yes. So the Baby Expo has been confirmed. We are going to be hosting it the 29th of August from 10:30 to 1:30. It's a free event. Vendors, we're hoping to have vendors there. We're hoping to have gently used or new baby clothing or items to give out to families, as well as diapers and wipes, and hopefully provide healthy snacks. We'll have like a photo booth and many more. And I believe there's going to be like a mobile unit that's going to be out there screening and much more to come. So if you're interested in taking part in that or even being a sponsor, I know Alicia, she left the chat, but you're welcome to join.
We'll be sending the vendor, well, once we finalize the flyer, we'll be sending out vendor registrations, right? It'll be attached to that. So if they want to become a vendor, they can just register for it. It'll have like a QR code on it once we get that settled, right?
Yes, correct. And Ms. Treva is going to be leading that. So if you are interested in being a vendor, I believe you can still contact Treva, but the logistics in signing up and all that will be shared at a later time. Well, if there's no other questions, comments, or concerns, we're going to give you guys the 5 minutes back. Thank you so much, everyone, for joining. You're appreciated. And if you'd like to, or if you know of anybody that would like to present at one of these coalition meetings, please message us or message me or Janet, and we'd be more than happy to have them.